Tell us, why is the Mississippi State Department of Health recommending booster vaccinations?
I mean, there are a number of reasons, and they did put out a report last week to let us know that this is something that we really need to consider. The deal is, right now, we're right in the middle of this pandemic. We thought it was getting better, but it seems to be getting worse again. I mean, the hospitalizations are up, the infection rate is up, and also the deaths are up. And also in this correspondence that the Mississippi State Department of Health provided for us medical providers, it was noted that right now over 80% of cases are due to this Delta variant. And the research is showing overwhelmingly that this Delta variant is much more resistant, and some of our immunity from getting the vaccinations is starting to not be as effective because we're having a lot of breakthrough infections. And these are individuals that have been vaccinated and now they're getting coronavirus infections again. And lastly, the research is showing that these individuals in many cases now are able to spread coronavirus. So the Mississippi State Department of Health is recommending these booster vaccinations so we can up our immune system and be more effective.
And what certain groups of people are being recommended, and tell us why?
Well, in the correspondence that they provided to the medical providers, they really emphasize to really consider our people that are severely immunocompromised. And they noted people that have had different type of organ transplants. Like earlier today, I had a patient that had a kidney transplant, and he's on immunomodulating medications to lower his immune system so his body won't attack that foreign organ that's now in his body. These individuals have very weakened immune systems and are very vulnerable. Also, it was noted individuals who had cancer and on medications to decrease their immune system so that the cancer cells won't be so aggressive and it can save their life. But due to the pandemic, these are some of our most vulnerable individuals in the population. Now, I did correspond with Dr. Dobbs, who is the chief officer for the Mississippi State Department of Health, and he also added that we're going to have to look out for our elderly patients, those that are 65 and older, and then those with chronic medical conditions. So it's almost like when the vaccinations first came out, these were the individuals that we were really targeting. And then once we got enough of these individuals, the vulnerable population, vaccinated, then we started going for the general public.
So when should patients get these types of vaccines?
Well, in the correspondence, they specifically noted 4 weeks after you received your last vaccination. So if you've had the Pfizer or the Moderna, which are 2 vaccination series, 4 weeks after you've had your last shot, or if you've had the Johnson & Johnson, that'll be 4 weeks after that 1 shot. Now, it was also noted, if you got the Johnson & Johnson, because the research is showing that the Pfizer is more effective, it's recommended to go ahead and get Pfizer for your booster if you've had Johnson & Johnson. And if you've had Moderna or Pfizer, get the same vaccine, the Pfizer or the Moderna that you got initially.
Okay. Thank you for that information, Dr. Quinn. Very important. And we'll be right back.
Thank you.